vulnerable are fraying. Drop-in centers that provided confidential counselling, HIV prevention, and basic health care to LGBTIQ plus people are being forced to shut down after major USAID funding cuts and contract freezes earlier this year. Rights organizations and local health monitors warn the result is immediate. Outreach halted, targeted HIV services scaled down, and safe spaces that one once helped people access medication and protection now shuttered. A blow to both dignity and public health. We speak to Gift Trapence, Executive Director of the Center for the Development of People, or is it CEDEP or CEDEP in Malawi? A very good evening to you, Gift, and thank you so much for speaking to us.
No, thank you so much. Evening.
Good evening. So let's perhaps start with the work that you do, and then we'll expand to what is at stake at the moment.
Yeah, CEDEP, we've been around as a human rights organization, but also we are into service provision. Specifically, we had 4 clinics that were offering HIV related services to the LGBTIQ plus community. These were the only LGBTI specific clinics that were offering HIV testing, STI testing, but also we were offering ART treatment. In fact, we had over 10,000 clients who are LGBTIQ plus individuals who were accessing services through these clinics. Specifically, these clinics were supported by the USAID funding. So after the funding cut, we have been affected hugely because we were relying more on USAID funding in terms of the operations.
And when you say 4 clinic drop-in centers for the LGBTIQ plus community, is it 4 across the country?
Yes, we had 2 in the south, 1 in the center, and the other one in the northern part of Malawi. But apart from these 4 clinics, we were also running some mobile clinics because of the geographical distance where these 4 clinics were also positioned. So we could also do the outreach mobile clinics to make sure that a bigger community is able to access the services.
And I just want to get a picture of how this would have impacted the available resources, those 4 clinics, those mobile clinics, particularly when it comes to this community. It seems like what you were offering is counselling services. What else were you offering, and how is this, them being shut down, going to impact not only on the community, but the larger community in terms of, community building in particular? Because we know that there's still stigma, there's still, discrimination. So how is this going to impact on what you've built on?
In fact, we have a very huge setback because these are the only clinics that were friendly to the LGBTIQ plus communities in terms of accessing the services, but also we had around 7,000 individuals who are on ART treatment, meaning that when the drop-in centers were closed, these individuals couldn't be transferred to other facilities because there was no proper transitioning in terms of making sure that we're able to hand over to the health facility run by the Ministry of Health. But also the issue of stigma and discrimination is also huge in the mainstreaming health facilities because they are not trained specifically to handle LGBTIQ plus individuals who are accessing ART treatment or who are accessing HIV-related services. So it has been a huge setback in Malawi, but also the communities, the LGBT community has high HIV prevalence. As we are talking now, we have increase in terms of the HIV rate amongst these communities, but also the issue of safe spaces are not there because we are also relying on these clinics as safe spaces where people could also access mental health counseling, apart from the HIV testing, but also they could also use these spaces for mental health counseling, including we were also able to offer some violence intervention whenever these communities are being experiencing violence in their communities.
And these closures have also affected the community that is HIV it's positive. What has been the impact on them, and was there prior communication when there was notice from USAID, PEPFAR, etc., to just say that there is going to be funding cuts? Because it seems that some of those centers, institutions that were receiving funding themselves were caught off guard.
Yeah, that's true. I think the message just came so abruptly in terms of not being prepared for the actual transitioning. We were just told that stop working, meaning that everyone was worried, including the communities that we serve. We did prepare the clients in terms of refills, in terms of the actual transitioning. There was panic for everyone because we had also to stop the workers from going to these clinics. Yeah, so we had no time to prepare our communities, but also we had no time as service providers, to make sure that we have cushioning, to make sure that we are not losing people who are on treatment. As we are talking now, I think we can't trace 90% of those people who were on treatment because the handing over was not there because we were just told stop, close the clinics.
So what disruptions have you seen? What has been reported in terms of treatment outcomes?
I think the first big issue is that I think is the issue of negative, perception from the service providers, because the message that I think went there, it is as if that key populations or the LGBT community are not important to access health services. I think we have had a backlash from the service providers in terms of stigma and discrimination, but also a backlash from policymakers in terms of them offering services to these communities. The funding cut affected not only the LGBTIQ plus communities, but also other, sectors, including women, children, meaning that the government had to prioritize which populations should be saved. So we have had challenges in terms of having discussions with the government ministries or departments to make sure that the LGBT communities are able to access services. We have seen that resistance in terms of trying to get resources to train the service providers from the Ministry of Health who are not sensitive to the LGBT specific needs when it comes to HIV related health service. So we need more investment in this area to make sure that we prepare the facilities for the LGBTI community to be accessing services.
But in general, though, it is just about ensuring that while key populations are affected, that we prevent deaths, because that is the greatest specter that we are facing in the health community. And thus the suggestion of domestic resource mobilization, ring fencing funding. But the question is there an appetite? Because from what you're saying, it seems that while there is awareness, there's either not speed in addressing the matter or clarity on what government is going to do to fill those gaps.
Yeah, I mean, to say the fact there is no, enough time, or there is no agency in terms of responding to the needs. Even when you talk about domestic financing, our health budgets are not funded according to the Abuja Declaration, 15%. Most of the time, the funding that goes to the health sector is below 90% in this case for this fiscal year. So in terms of the resources, domestic resources, we are still struggling. So as civil society, we have also been pushing for the government maybe to have alternative in terms of resource mobilizations, maybe introducing some specific levies, either from alcohol or even fuel levy, to make sure that these resources are put or are directed to the health sector. But as of now, we are in a crisis, if I may use that, because we don't have services that are comprehensive enough going towards the LGBTIQ plus communities. I think it's a crisis on our part.
And public-private partnerships that are in existence, could they assist in stemming the impact of the funding cuts?
I think the issue of private partnership hasn't been comprehensive enough, because I think there is no specific policy to guide that the social corporate responsibility. And most of the service provision has been offered by the government. Very few cases where the private sector comes to intervene. I think it's an area that we need to explore as a country in terms of having some specific policies that can woo the private sector to support the healthy sector. But at the moment, I think what we need is a robust, comprehensive policy on corporate social responsibility of these companies. But as of now, I think we don't have that partnership in terms of HIV-related interventions.
Okay, we're going to end it here with you, unfortunately, but thank you so much. Gift Trapence is Executive Director of